I think we should be focusing on saving lives and safety rather than getting hung up on gender, personally.
For years, Jeremy Hunt, when he was the Health Secretary, he was the longest-serving Health Secretary in Britain,
I remember,
said he was going to get rid of mixed wards.
That's right.
And they never did.
And it seems extraordinary that you could be a woman in hospital, possibly walking around in your pants and one of those gowns with your bum hanging out.
Exactly.
And there could be a man in the next bed. How is that even possible in a developed world?
Appalling. But they never got to grips with it. We're streeting the Health Secretary. He's now got the challenge of the ruling on the Supreme Court.
That's right. So he has to enact that. Now, there are rumours that some NHS hospitals, some wards are saying, no, we're not doing it. We're just not abiding by that. If somebody wants to present to our hospital and they are a biological born male, but they see themselves as a woman, we will still put them in a women's ward. So
this is going to be a collision course because although we've got clarity, haven't we, from the Supreme Court about what's a woman, what's a man, we haven't got clarity in this area. And Lord Sumption, the former Supreme Court judge, said there is a lack of clarity.
Yeah, there is a real lack of clarity. Shall we go to our guests?
Yes.
Let's speak to the spokesperson at the Alliance Defending Freedom, Lois McClatchy-Miller, and GP Basha Mukherjee. You're going to have to do this because I have no talk back.
Let's talk to you first. Basha Mukherjee, what is your position on the wards? Should we have should there be mixed wards? Should they be outlawed completely?
I think there are more pressing issues. And I want to add that I've worked in hospitals myself, and I've seen that we have vulnerable elderly people who are deteriorating and dying in the corridors because we don't have enough beds, let alone, beds that are specifically allocated to certain sexes. So,
Lois, are we getting hung up on the wrong issues here?
100%.
No.
I mean, I as much as I'm a doctor, I'm a patient myself. I've had a recent family member who's been admitted to hospital. They were having profuse diarrhea and vomiting. They would have been a huge infectious risk to other people in the same ward that they were, but there weren't enough side rooms for them to be put in. And that's why they had to share a ward with other elderly people who were being put at risk, essentially. And this is across 3-4 days, not just one day. So what we're seeing is that there's a lack of rooms and beds. So I don't think gender is really the top of our priorities.
Have you been getting a load of spam in your email recently? What about random calls? It's really annoying, isn't it? Data brokers are out there collecting your personal information. Anything from your email, your full name, your address, and even your political affiliation. Cyber criminals can even use AI to mimic the voices of friends and family to trick people into sending them money. And it gets even worse. People out there are getting huge loans taken out in their names without even knowing about it. But don't worry, because the sponsor of this video, Incogni, can help. They reach out to the data brokers on your behalf and request that your information is removed from their databases. Incogni continues to make sure that your data is removed automatically from the internet via repeated removal requests. So, how can you get started? Well, step 1, hit the link in the description, create an Incogni account and tell us whose data you'd like removed. Step 2, grant Incogni the right to work on your behalf. Step 3, sit back, relax and watch Incogni work. They will update consistently so you know when your data has been removed. Incogni is risk-free for 30 days, so you can try it for yourself and you'll get a free refund if the service isn't for you. So take back your personal data today with Incogni. Use the code GBNews using the link in the description below and you'll get 60% off an annual payment plan.
Lois, what do you think here?
Well, when my mother had cancer treatment last year, throughout the year, she talked about the importance of privacy and dignity in a hospital setting of all places. When you're feeling particularly vulnerable, when you've got a gown on and you're having to get up in the middle of the night to use a shared bathroom and use shared shower facilities as well. It's absolutely common sense. And that's, for your average female patient who has that right to have that privacy and dignity. But think also about people who are in hospital who are domestic abuse survivors, who have extreme needs for that extra layer of safety and comfort to be in an all-female ward? What about women of particular religious backgrounds, be it Muslim or Orthodox Jew or particularly conservative Christian? They all have a particular need to uphold a different standard of modesty as well. And having comfort, having everything as comfortable as it can be whilst you're in that vulnerable state is critical for healthcare. I think it's the least we can do as a country for women who have paid into the health service, who just deserve that dignity, respect and privacy by being on a single-sex ward. It's unthinkable that we wouldn't allow them that.
Basha, come back on that.
Yes, so absolutely, I agree. In an ideal situation, in a healthcare setting that was actually functioning and actually providing for whatever we're paying for, I think that would be the ideal situation. And as a woman, 100%. I would vouch for that. However, our healthcare setting is not even delivering on simple safety measures, let alone, pertaining to people's preferences. I think in this case, it's a case of life and death rather than, I think life and death comes first sometimes when it comes to comparing with preferences, religion, etc. Although I 100% agree with what you're saying, I think in this case, our healthcare settings are completely not performing to the standard that they should be.
Lois, now we've got this position with the Supreme Court ruling. The Health Secretary said only yesterday, or was it even today, I may have heard him talking about it, said it is now going to be a challenge. Is it a challenge or is it clear cut? Only biological women should be in those wards?
Well, it's very clear cut. Yeah,
let's hear Lois on this.
Yeah, it's very clear cut indeed. The Supreme Court has said that womanhood depends on biological sex. And, we were taught wrongly by toxic feminism for many years that all men are predators, and that's obviously not true. But it's ignorant to say that no men are predators. And now this kind of liberal progressivism says that all men are predators unless they're in a dress and wearing lipstick. We can't allow some men onto a ward and not others just based on what they're wearing or their preferences. We have to maintain this single sex just based on basic biology, protection for women. It's this very basic standard that we should have always expected. And now there's really no excuse. The Supreme Court has been clear. Womanhood is defined by biological reality. And the NHS, of all people, should know that and should implement it to protect the vulnerable patients that they seek to serve.
Basha, you obviously studied medicine. You've studied as a doctor. You understand biology better than the other three of us in this particular debate. Does it pose a particular challenge to you when you're confronted with somebody that is transgender in your treatment room? Is it difficult for you to know the language to use and maybe the tests to suggest even?
I think I knew before I went to medical school what a man or a woman was. First of all, I think that's something most of us do.
The Prime Minister didn't.
Regardless of that, in terms of obviously the patient in front of me, my focus is always about whenever I'm with the patient, it is about the patient. So if the patient feels more comfortable with me referring to them as a different pronoun, I will use that because I am pertaining to them. I'm at that point in time, I am, giving them a service. However, in this story, we're talking about safety of women. I just want to say, I can only see this adding a further bureaucratic burden on the system rather than actually being of help. Because if we're talking about safety and having single-sex wards, safety is not limited to just having a door. And there are perpetrators, if they wanted to, they would make their way through doors, and we don't put locks in doors in hospitals, and there's definitely cases of violent men in men's wards coming across and attacking females or female staff, or even staff members, whether male or female, acting as perpetrators. So I can just see this adding a bureaucratic burden more than anything else.
Lois, let me just ask you one last question. We had one of our commentators earlier saying that the celebrations after that Supreme Court judgment were too triumphalist and you should have toned it all down, frankly. It wasn't the sophisticated way to respond. What would you say to that?
Well, if you look at the statements that were in the Supreme Court ruling, things like men cannot be pregnant and sex is binary, these are things that 5 years ago you might have lost your Twitter account, you might have lost your job, you might have lost your friends because you said them. And now a court, the highest court in the land, is affirming what we have always known throughout human history to be true. So I don't blame anyone for feeling vindicated in these truths. It is, of course, important that we pull together and now put these solutions for safety in action, whether that's in the NHS and the education system, the prison system, and elsewhere. Because ultimately, this isn't about size. This is about safety, dignity, and privacy for that 51% of the population.
OK, thank you both. Spokesperson for the Alliance Defending Freedom, Lois McClatchy-Miller, and GP Basha Mukherjee.
Interesting debate.
Really interesting. And I think I share Lois's concern there is all fantastic, marvellous, great, let's just all move on. And because it's just women stuff still, isn't just women affected by it. But actually we need to change these settings.